Hi, this is Dr. Joseph Witt-Doerring here, and today we're going to be talking about a question we get asked a lot at our clinic, which is how long does it take to taper off benzodiazepines? And it's kind of a difficult question to respond to, but to break it down and make it simple, I kind of think about it in two ways. So there's two classic patients that come to our practice. We have patients that maybe they've been on benzodiazepines for several years, but they're not really having any problems. They've just decided that they want to come off and they want to do it in a safe way. They're not having all these neurological problems like some of our other patients have. And then there's the second group of patients who come to our practice because they have protracted withdrawal, which you may have heard about since, recently in 2020, the FDA, they mandated an update of the labeling for all the benzodiazepines, and they talk about kind of a syndrome of neurological injury that happens to some people when they're withdrawing from benzodiazepines, sometimes when they're still on them, where they develop a whole spectrum of neurological problems like tinnitus, paresthesias, which are sensory problems, and a lot of anxiety, depression as well. So when we're thinking about how long it's going to take you to withdraw, you need to think, which bucket am I in? Am I in the bucket where I don't have protracted withdrawal, I'm not having these neurological problems, or am I someone that started to have a lot of problems coming off the medications, which are different to the ones that led me to eventually be on them? Okay, so now that we've got those two groups, the first group's a lot easier to treat. These are the individuals that don't have neurological problems. With these patients, you can actually move fairly quickly. And by that I mean you could probably get someone down within about 3 to 6 months. Sometimes you can move a little faster if they're not on a lot of medications, if they're not on a very high dosage. But you really move at their pace. Typically we make 10% cuts, and if they're doing very well, we'll encourage them to make a 10% cut, say every 2 weeks. Sometimes people are a little bit more eager and they'll go a bit faster, but a 10% cut every couple of weeks is pretty good, and that gets most people done in 3 months, 6 months. And so that's fairly straightforward. Usually they have great results and they don't have any problems afterwards. The second group of people is a lot more tricky. These are individuals who they've got a lot of neurological problems. They're the patients that often know about this condition already, and they may be doing dry cuts or they might be doing liquid tapers. For these individuals, sometimes we move a lot slower. And we might have someone on 20 milligrams of Valium, which is probably the equivalent of a milligram of Xanax. And we might have them come down over the space of a year or a year and a half. And this is not because we want to move really slow. Typically, we move slowly because the person is in a lot of discomfort and they're extremely sensitive to dose drops. So that's when it gets a little bit more tricky. With these individuals that have these neurological problems, they'll often be tapered over several years, sometimes up to 3 years, but it really depends. So I hope that helps answer that question. If you've been wondering, how long would it take me to come off my benzodiazepine? And that's kind of the two ways we really look at things. So I hope you enjoyed this video, and thank you.